Hello, my name is Cordula Anhut-Franke. I'm a dermatologist born in Germany and working in the beautiful island of Mallorca. And I have specialized in aesthetic dermatology and laser dermatology. So now we have a lady, she's a bit challenging because aging 53, she has quite an advanced stage of photoaging, and unfortunately, because she's quite a heavy smoker, we have a dramatic loss of elasticity in her case. So the aim of our treatment will be first to address the pigmentation, the age spots, and secondly to improve her elasticity, her texture of the skin, also the enlarged pores. This will be a serial of treatments, so we cannot achieve this in one session, but we are going to start today with a combination of IPL plus Picoway laser with the Resolve 1064. And so we do see the signs of photoaging, pigmentation, lentiginous, seborrheic keratosis here, and we do see that the skin has lost the elasticity. Yeah, so the skin, and this is due to the UV exposure, to the chronic UV exposure. And the aim of the treatment today is to improve the texture and the tone, and also to improve the collagen tissue. First, for the pigmentation, I would use the IPL, the PR handpiece. We should have a really nice result. Then we can see here on her nose, she has a few broken capillaries or telangiectasia. So these we are going to treat with the NDYAC laser, and then we will move to our Picoway and we will treat the full face with the Resolve 1064 handpiece to improve the texture of the skin, the collagen. So I always start on the right side of the face because this is the side which is less painful for the patient. So let's start with this setting. We are at 7 joule. This should be sufficient. Maybe we go a little bit higher later. Yeah, but let's see how the reaction is going to be. Here we go. Okay, yeah, that's how it is, okay? Yeah, now we can clearly see already the change of the color in our pigment. Definitely on the dense pigment here under your, I'm again under your eye, I'm sorry. So we are efficient enough with the 7 joule. On the brighter pigment, we could go a little bit higher. And I'll do a second pass here to address the pigment. She has no vascular component, which is rather unusual. Yeah, for the Caucasian skin type, we see a lot of vascular component usually. On her, it's not the case. Yep, but now you can really nicely see the change of the color even in the lighter pigmentation. So that's perfect. This is our endpoint for IPL. All right, now let's move on the temple area. Okay, let's move to the left cheek. So when we do a multi-layer approach, I think the most important thing is really to give the patient an instant result. It's important that they do see a result. So that's why I never do Pico or Resolve or Frax 1550 alone. I always combine it in a multi-layer technique. either with the Frax 1940 or with the IPL. Not always full face. Sometimes we just treat certain spots. But this is what people look at. They look at the spot a lot more than at a line or at an enlarged pore. Yeah. So, and what we want is we want to make our patients happy at the first place because they pay a lot of money. We want them to come back, and we want to convince them with our technology. And we cannot really explain to them. You have to wait 3 months before you start seeing a result. Yeah. So that's why I find it is very important to combine both technologies always. And also what is for me very important, we have a lot of people like Victoria, so people who spend a lot of time in the sun, so we do see clearly not only that the skin is aging very fast, but we also see sun damage, proper sun damage, which is an issue of our skin's health. And being a dermatologist, I feel really responsible to guide our patients also in their skin health, and make sure that they are fine, that they do not develop any skin cancer, that we treat pre-cancers in early stages. And therefore it's important always to combine this with a Frax 1940, so to work superficially, to use good products, to use active ingredients. Yeah, we never treat patients, if they don't agree to that. So it's important not just to focus on the attractivity, but also on the skin health. And now I'm going to change to Age Jewel and do a second pass on the lighter pigment. I know, it's almost over, okay? Mm-hmm. Almost finished. Okay, so here we have a really great reaction. Yeah, so that's perfect. What I would like to do is on the seborrheic keratosis, we go a bit higher. Yes, and we do see a grayish discoloration. I'm going to do a second shot on this one, and this will come off. So there's no need for an ablative laser in this case because it's a flat seborrheic keratosis. Here we go. Nice. So that's sufficient. So now, so this is a wonderful endpoint of the IPL treatment. Yeah, so we see a clear darkening on all spots, on the dark ones, on the lighter ones. We also see a change of the color on the seborrheic keratosis, like here and there. And we see not much redness. Yeah, so that's exactly what we are aiming for. Do you see them better this way?
Yes, if you move them a little bit like this is better, yeah. Okay.
Okay, here we go. Yes, now we see here the change of the color. No. No, they're gone. See? They're deep. Now you see they're gone. But they were really deep on here. Let's do this one here. Yeah? nicely, no? No. It's quite a stubborn one. Okay, here we go. Okay, now comes a light flash again. Okay. So that was interesting. So it was a lot more superficial than I thought it would. I thought it was a deep one, but it didn't respond so well with the NDAC. Now we have a much better response rate with the IPL. So we go with continuous movements over the skin, always with the same pressure and without stopping. How are you, Victoria? It's okay for you?
Yeah.
Yeah? Keep a nice tightening effect. And along the nasal fold. And very important also to work under the eyes. And we can see that the skin tolerates it really, really well. So we have just a slight redness so far. I would go up to 1200 in her case, yeah? It depends. So we always need to watch the skin. Some people get quite early pinpoint bleeding. This will be always our endpoint, but we can see in her case, so it's about 1200 shots. Yeah, but we can see in her case, a beginning pinpoint bleeding, maybe here, it's not a severe reaction. Yeah, so this is a perfect endpoint. Oh, sorry. We can already continue with the left cheek. So I always work in aesthetic units. So my cheek always goes from the nasal level fold under the eye up to the crow's feet, up to the marionette line. This is where we usually do between 1000 and 1200 shots. Yeah, on both sides. Then in her case, we can see on her forehead she doesn't really have a strong problem. So the skin is fine, the pores are not so enlarged. So here I would do maybe 800 shots. And then I would divide the last 1000 shots between the nose and the chin area and the philtrum area. So I'd always try to stretch the skin a little bit, you know, so that we have a gliding movement, yeah, so that we don't jump over the skin. You can see sometimes in areas where the skin is very loose, this can be not easy, yeah, so it's important really to stretch the skin here nicely, so that the gliding is easier. very careful on the eyebrows, on the permanent makeup. There is a little bit of absorption in the pigment as well with the Resolve. So on the forehead it's a little bit more difficult to work on, so that's why I divide the forehead into two parts. So I do half of the shots on the right side of the forehead and half of the shots on the left. I find that easier, but do a few extra shots. So this skin is a lot more delicate, so we have easier pinpoint bleeding, even with a few shots only. Yeah. I know, Sally, this is quite uncomfortable now. Oh, I'm so sorry. For the aftercare, after Pico, it's super important not to use any greasy creams. Yeah,
okay.
Just hydration. This is really essential.
Hydration.
Yeah? Hydration. So we recommend hyaluronic acid. We recommend vitamin C and sun protection. No extra creams. No night creams. No, not too many creams, because some people tends to get acne like pustules, you know, and they can be quite unhappy about it, and you seem to aggravate them if you use greasy products in the first couple of days. So any serums that do hydrate the skin, we always have our serums that we recommend, but it can be any other hyaluronic acid, you know, but no creams. Sun protection factor 50. Yeah, this is important. In your case, I would use an oil-free sun protection, yeah, because we do have a mixed skin, so we don't really want to block the pores and aggravate, you know,
nothing
some
in the night.
Extra impurities.
No creams on the night. Only in the morning.
Just hydration. Just hydration. See, you don't need extra cream. If your skin feels too dry, you can use a bit of eye cream around your eyes, but don't use anything in the T-zone.
Okay.